Millions of people who take prescription drugs are seeing higher prices. In a study last year, a third of Americans surveyed said their bills went up from 2014. That even included generic drugs. A tech startup called Blink Health is on a mission to change that. The app and a website provide access to the lowest prices on generic prescription drugs. Almost half cost less than $10. They can be bought at all major pharmacies, more than 60,000 nationwide. Matthew and Gregory Chaiken are the co-founders. They're also brothers, and we're pleased to have them here.
Thanks, Charlie.
Geoffrey Chaiken.
You spell your name like my husband does, so you spelled it right way. Geoffrey.
But look at Matt sticking up for his brother, Geoffrey. All right.
How old are you guys?
I'm 34.
I'm 30.
All right.
Okay.
You say this is like Groupon. We all remember what Groupon was like.
Yeah, so it's kind of like Groupon in that the way it works is you go to blinkhealth.com,
Right.
you look up the name of your medication, you see a price. The price you see there is the price you get at over 60,000 pharmacies nationwide. If that price is less than what you normally pay for your prescription, and it probably will be, you pay for it online. We provide you with what we call a digital Blink pharmacy card. You show that card to the pharmacist, they type in the codes on that card, and your medication rings up as $0.
But Geoffrey, how are you able to do this? Because it sounds so simple.
Right.
How are the two Chaiken brothers able to pull this off?
Well, I think that the key thing is that before Blink, the only thing you couldn't buy on the internet, essentially, were prescription medications. So if you think about Amazon or eBay, the only thing you couldn't find there are prescription meds. And so...
But I thought people were buying prescription meds from Canada for cheaper prices.
Well, so illegally.
Yeah.
But and you couldn't get them at your local store. So, and the other thing that is interesting is that people don't like mail order for their prescription meds. So what we had to figure out a way to do was, and what we also recognize is that when things go to the internet, we know when things go on Amazon or eBay, prices go down and experiences go up. So what we cracked the code on doing was basically figuring out how to allow patients to purchase their medications online, but still pick them up at their local trusted pharmacy where they have a relationship with their pharmacist.
So do you make a deal with all the pharmacies?
You have to
Exactly.
Do
that. So the important thing was that we actually have contracts with every single pharmacy in the United States. If the pharmacy
What's the nature of the contract?
So what the nature of the contract is that they accept our prices. So we have different prices at each pharmacy, but what's important for consumers is that when they go to Blink, there's one price that they're going to see, and they'll get that price no matter which pharmacy they go to. So it makes it a super simple experience for those users, and there's only one price.
Is there a general percentage in difference between your prices and most pharmacy prices?
Yeah, so what we say is 50% of medications cost less than $10 when you buy them on Blink. And as we all know, insurance copays are going up, and most insurance copays are more than $10. And for the 30 million people in the country that still don't have insurance, they're typically paying the retail price for medications at their pharmacy, and those prices are through the roof. And to your point about Canada, what we've found is that there's obviously millions of Americans who are buying their medication from Canada. They shouldn't be, because there's actually laws in place that prevent Canadian drugs from coming into the U.S. But what we found is a lot of those patients are actually now choosing to pay with Blink and pick up their medication at their local pharmacy. So CVS, Walgreens, their independent pharmacy.
But when Gil asked, how are you able to do this? Are you able to offer a cheaper price on pharmaceuticals because you're cutting the overhead, you're buying in bulk? I mean, that has always been one of the suggestions, is that the government, which is the largest buyer of pharmaceuticals in the country because of Medicare and Medicaid, Veterans Affairs, that they should be negotiating lower prices. How are you getting lower prices?
Yeah, so it's a great question. So basically the way that we're doing it is that these prices that are offered on Blink have actually been offered to a small swath of the entire population today. So
what swath is that?
On a percentage basis, it's probably less than 5% of the population. So the CEOs of the largest companies in the country are getting access today to the Blink price. But in order to do that, they have to pay for extremely expensive platinum insurance to get access to those prices. And what we figured out how to do was that by grouping people together, sort of we're the collective voice for consumers. If you think about in healthcare, there's no one who represents consumers in healthcare. And so what our organization does is it pools consumers together using technology, and then we can give them a huge collective voice to give them access to those prices.
So there's power in numbers.
Huge power in numbers. So the more people who join also, the lower our prices will get.
But back to your business model, your app is free.
It's totally free.
And so where is your income?
So the way that it works is that we make a small transaction fee for every transaction that occurs. And actually, on some medications, because we decided to make the price the same at every pharmacy, and our costs are different, sometimes we actually lose money on a transaction. But on average, we make a little bit of money per transaction. but we would only make money if we saved you money.
So it's a percentage of the sales price, or what?
It's not a percentage of the sales price. It's just that we price and our costs vary based on the pharmacies that patients go to. And so we make a little bit of money depending on which pharmacy or which medication that someone uses. But all of the transactions are refundable. So we don't want to make any money unless we save you money. And you're able to see the price before you go.
So Matt, your dad's a doctor, your grandfather's a doctor. Was it because you all were around healthcare so much you said, we got to do something to help the people?
Yeah, so I think it's no surprise to most Americans. It's gotten a tremendous amount of media attention the last several months given what's going on in the pharma space. Patients are just overpaying for their medications. Most medications should be really inexpensive, like Lipitor.
How much is Lipitor?
It's $8 with Blink Health. Our father actually takes Lipitor, is now buying it with Blink Health. He has the best insurance you can find, and he's still saving 50% on his medication.
The Blink price on Lipitor is $9.94.
Correct, for 20 milligrams, and if you take the 10 milligram version, it's only $8. And we're also giving every consumer $5 off their first purchase. So that medication's almost free.
And balding men around America will be very happy about the price of Propecia.
As my brother will now throw
I'm
me
now
under the
throwing
bus.
my brother under the bus in front of millions
You
of
look
people.
great. You look
Geoffrey, whose hair does look great, is balding, and he does take Propecia. And he was actually,
Geoffrey, Chaiken, we gotta go.
Thank you, man.
We gotta go.
Thank you.
But there's so much interest in this. Thank you so much.